An infectious disease chairperson of a large hospital determines that the incidence of Clostridioides difficile infections or C. diff infection at the hospital is too high. She proposes an initiative to restrict the usage of clindamycin in the hospital to determine if that lowers the incidence of C. diff infections. She puts in place a requirement that an infectious disease fellow needs to approve any prescription of clindamycin. After 2 months, she reviews the hospital infection data and determines that the incidence of C. diff infection has decreased, but not to the extent that she had hoped for. Consequently, she decides to include fluoroquinolone antibiotic in the antibiotic restriction and examine the data again in another 2 months. Which of the following best describe the process being used by the infectious disease chairperson? Your options: high reliability organization, root cause analysis, failure mode and effect analysis, plan, do, study, act cycle, and lean process improvement. Okay, so here we have an infectious disease chairman who kind of recognized that C. diff infection is going a little bit too high. And so she thought, let's just, restrict clindamycin and see what happens to the C. diff infections, whether they go down or not, or, what happens, whether it's clindamycin or whether it's something else. So when she stopped clindamycin, she noticed that she reviewed the data and she noticed that the incident actually went down, but not up to what she hoped for, basically, right? Moreover, she didn't actually just stop clindamycin altogether. She basically asked a fellow to actually approve any prescription if it's required. So you're not just giving clindamycin to anybody, you're only giving it to people who actually requires it, and also it's through a prescription. Moreover, when she thought that the results that she hoped for weren't that great, so she's also included fluoroquinolone antibiotic, and she's going to check the data again in another 2 months. Basically, this is a very good example of plan, do, study, and act cycle. When she recognized C. diff infections are going high, she planned to restrict C. diff infection and asked a fellow to approve any prescription of clindamycin. Okay, then she tested it. That means whoever were not treated with clindamycin, she actually tested whether that actually worked in decreasing the infections. She studied the data, so that comes under study, and then she implemented it. Now, implementation here could mean that you actually restrict somebody from taking clindamycin, or if the results weren't that great, that means when you studied the data, if the data weren't up to your expectations, you acted according to your outcome. Okay, here the outcome wasn't too great what she hoped for. So here what she did, she also restricted fluoroquinolone. You get what I mean? So here it's a very good example of plan, do, study, and act cycle. Make sense? High reliability organizations. As the name implies, these are the organizations that actually have a very low failure rate. They have been working for a period of period of time, years maybe, but they have a very low failure rate. Now these organizations could be anything in terms of in a hospital setting, basically. But what do we mean is that they have a very low failure rate. That's the bottom line. Okay, here we are not looking at any organizations, or we are not actually considering patients to consult an organization that has low failure rates. We are not doing that. We are actually doing a plan, do, study, act kind of a cycle thing, right? Root cause analysis. Yes, we are looking at the root cause analysis of infection, but what she did is totally different from what root cause analysis would do. In a root cause analysis, what will happen is that you will take the patients who had the infections with C. diff, and then you will see, how much, whether they received clindamycin or not. If they did, how much clindamycin did they receive, and for how long, So that is a retrospective way of looking at why this patient had this infection. But here we are not doing that. They already described the process to you, and they are asking you to identify the process. Make sense? That's why this is not the root cause analysis. Failure mode and effect analysis. Now, This is, as I said before, it is a prospective way of looking at a study or a method or whatever, any device or intervention that you're doing. But we are prospectively looking at it and then we are improving it. Over here, we already have a situation and we already acted on, right? So that's why that's not the answer. Lean process improvement, as I mentioned before, it is to save time, energy, and resources on unnecessary diagnostic tests and treatment, and we kind of implement it or invest it in people who actually needs it. We are not using that over here, and that's why that is not the answer.
Thanks for watching. Please give a thumbs up and subscribe for more.